Lisa, I think we can go ahead and get started.
Okay, great. Thanks. Good afternoon, everyone. Thanks for coming. I'm Lisa Muser, and I'll be facilitating today's session. So as you have questions, you'll be putting them in the chat function for me, directly to me, or just in the chat function in general. We also have Bridget Nasby hosting our Zoom session today. If you have any technical questions, please message her privately. And we're so happy to have Linz Badger as our presenter today. Linz has been helping people and organizations build healthy relationships for nearly 10 years through Middle Way House, New Leaf, New Life, and BTCC. Our session topic is youth trauma and resilience in a pandemic. As Linz said, we'll be recording this session today. It'll be available for viewing on the website, the BTCC website. And there will also be handouts available on the website. So let's go ahead and get started. Linz, I know you have a lot of great information for us. Thank you for being here.
Thank you. All right, so I want to run this maybe a little different than the Zoom sessions that you spend a lot of time in where people just talk at you. And I'm going to ask, I'm going to let you know what my commitments are to you, and I'm going to ask you to make some commitments while you're here. So I'm going to commit that I will briefly introduce the ways we understand individualized and collective trauma for youth in the pandemic. I'm going to commit that we can consider the limits of things like the ACE model as an assessment tool and the interventions and risks for resilience-based responses. And I'm going to center the way that a pandemic, which actually means all people, requires us to move from sort of individual frames about resilience to collective frames. And we're going to build our own social ecological model. We're going to do this work together. We're going to be in a shared document to really think about how we build pathways towards youth resilience in our community when we're the actual change makers. I'd like to ask you to share your ideas. Lisa mentioned that they're going to collect them from the chat. You can also drop them directly into the Google document. Bridget is sharing that link in the chat. So you should be able to click right on the Google document. Sometimes some of you might want to keep that document open on the side. We're going to actively engage it about slide 10 or 11. You can look at it now. I might just jump us over there. So it's coming. We're going to actually build out some ideas about how we can build resilience for youth in our own local space using this the social ecological model. I'm going to give you some examples of the work I do for that. On the second page of this, in our shared document, it's going to let me scroll down, is a question garden. It's a spot that you can drop questions as we go. You can also drop them in the chat if that's easier and you want to stay single screen, and Lisa will move them over. And then finally, on the third page, you can access the PowerPoint here later on. It has all my citations in it. I told folks who got in here early that we're going to move kind of fast through some information, and so that we can do this stuff, like we can do the work of it. And if you would like to be linked directly to this document, you can put your name and your email address here. Everyone has access to this document with this link, and I'm not going to shut that down. But if you actually want to be able to like store it in your drive, you can drop the link here, and we'll make sure we send out the link to this document. So I'm going to ask you to share your ideas. If you can share using I statements rather than generalizations about what youth experience or what people experience, and consider your own impact as you do that. In your personal notes, I'd love if you have like pencil and paper with you. Try to write down some ideas. And when you're writing down ideas, we emphasize keeping ideas, not IDs. So maybe not information about humans that they disclose about themselves, if that happens at all, but instead some of the rich ideas that we might take forward. I want to invite you to write down 3 times as many questions as you write down ideas. So you can fill up that question garden. I'm not going to answer all those questions today. A lot of what I want us to do is start asking questions about how we actually move towards youth resilience. How do we do the work of it? What are our commitments? And that's maybe our final commitment from you. I want you to actually make a post-presentation commitment. Maybe follow up with a fellow participant that you start to chat with in the chat box about an idea and you like the things they're saying in the chat room. Maybe you handwrite this list of questions and you just tape it up somewhere so you can keep dealing with this stuff. Maybe you follow up on some of the things you can do to take action in the community from the SEM model that we're going to build out. I want to prep you for this because I want you to really actively engage this day. So we're going to start with the impact of childhood trauma. I'm not going to spend a lot of time with this, but I'm curious if anyone wants to turn a mic on and just share some of the things that you are noticing about this. What are some of the things that you notice when we talk, or some of the things you hear often when we talk about childhood or youth trauma? I'm not going to read my slides too. I'm going to ask you to keep helping me out and notice and point some things out. So y'all can get used to that and turn a mic on and throw some ideas out. What are some things that we notice about the ways we talk about childhood trauma?
Maybe how the behaviors are showing up, not late to school or not paying attention or things like that.
Yeah. Yeah. Are folks like fairly familiar with this way of framing childhood trauma? Is this totally new information to anybody? BTCC does another training specifically about trauma. If you are interested in talking really specifically about the ways that trauma impacts a body and a brain and behavior, and also the broader world. But I want us to kind of get the framework. The other way we often talk about trauma is through the ACEs model, which we'll get to next. But at this moment, I want us to also think outside of the individual and to the collective. So at this moment, the Federal Substance Abuse and Mental Health Service Administration noted that before COVID, 2/3 of kids experienced at least one serious traumatic event by the age of 16. And early data from COVID-19 shows that risk factors and outcomes for young people experiencing at least one seriously traumatic event are seriously increasing at this moment. So we were already at 2/3, and now we're at significantly more than 2/3. They don't have all the data crunched, but we're at significantly more than 2/3 of young people who are experiencing at least one seriously traumatic event in their life right now, and many of whom are experiencing habitually traumatic experiences. This is a slide that I pulled and go back to that was actually one of Stephanie Solomon's when she worked to talk about both how we look at young people who experience trauma and how maybe this model doesn't let us get to some of the critical questions we should actually be asking about youth trauma. And so we note that when we talk about ACEs, adverse childhood experiences, we're thinking about low on the SEM model ways of understanding trauma. So we're looking primarily at individual or internalized and interpersonal level traumas that it doesn't explore the broader roots or context of experiences, especially the social context of experiences. And there's an assumption that ACE scores might predict outcomes. That's the assumption of ACE scores. People take ACE tests and there's an assumption of outcomes, most of which are bad outcomes. And so people think about reducing things like household dysfunction or neglect or abuse in young children with the aim of positive outcomes later. But the actual ACE scores don't necessarily translate to any availability of needed or appropriate resources or changes to the environments and the systems that young people have to navigate. And our narratives on ACEs often are hyper-focused on what individuals can or should do to reduce potential for poor health outcomes, like take more walks, eat better, engage in fewer risky behaviors. The burden is totally on the individual. Folks who are trying to lean into resilience models sometimes also cite PACEs, protective and compensatory experiences. Again, this is like having daily routines, regular physical activity, engaging a hobby, living in a clean, safe home with enough food. The burden is really, again, on the individual and the individual's family to some degree. Unconditional love from a parent caregiver being number one. And so either a young person is expected to equip themselves or be born into a space where they have unconditionally have everything that they need. And while these are fantastic goals for individuals to have, and fantastic goals for families to have, we're missing something when we actually think about supporting folks through trauma, and missing something when we're thinking about what it means to frame ourselves within resilience. But resilience also has some issues with how we often frame resilience. This is drawn from the Building Community Resilience model. And I think it's one of the ways where we start to look at adverse childhood experiences as expressions of something that is much deeper. Much deeper rooted. And it is a way that we start to engage the social ecological model, which thinks not just in the levels of the individual or the interpersonal, but also in terms of agencies and institutions and environments and social norms and public policies that become part of how people's childhood experiences and how trauma, both at the individual level and at the social level, comes to manifest. I want us to just go ahead and read this to think about what a resilience framework is, because the way resilience is framed through things like child trends, actually, I think is a strong foundation. Before we get too deep into this, though, I want us to think about how resilience works against people as well. I'm curious if someone who's in here would be willing to read these two paragraphs to everyone else. So you get a second to not hear my voice and hear someone else's. Will someone else come into the room and read this for us? Anybody?
I can read it.
Thank you.
Can you hear me?
Yes.
Okay. Resilience to childhood trauma. When parents, service providers, and programs employ a resilience framework to childhood trauma, they understand there are always opportunities to support positive developmental trajectories among children, even if they have experienced trauma. Resilience has been defined as a dynamic process encompassing positive adaptation within the context of significant adversity. Resilience is not a personal trait that individuals do or do not possess. Thus, the term resiliency is best avoided because it connotes an individual characteristic, but rather a product of interacting factors, biological, psychological, social, and cultural, that determine how a child responds to traumatic events. Resilience to trauma can be defined in several ways. Positive child outcomes despite exposure to trauma, prevention of trauma reoccurrence despite high risk for further exposure, or avoidance of traumatic experiences altogether in the face of significant risk. All three of these conceptualizations of resilience are based on an ecological approach.
Thank you. So we have three models of resilience in this that are based on an ecological approach, which is what we hope to build today. I'm just going to emphatically say these again. Positive child outcomes despite exposure to trauma. What would that look like? Can you give a scenario, anybody? A positive child outcome despite exposure to trauma.
Someone who is compulsive to get their work done.
Yeah. Okay.
And they become very successful.
Yeah. How about prevention of trauma reoccurrence despite high risk for further exposure? What are one of the interventions we make that we think of as resilience building that's in a prevention framework? Even if kids stay in a home that is deemed risky based on an ACE score, what are some of the prevention strategies that we put around that child that might prevent reoccurrence? I know there are a couple of primary prevention people in the room. Anyone want to help me out?
Sorry, repacking greens. Like helping build other stable relationships that folks can tag in. So even if they're still like living and sitting in a situation that feels unsafe, they at least have reliable and consistent folks that can be tagged in when things do come up or when like warning signs or triggers are starting to show up.
Yeah, thanks. Awesome. How about this third one? Avoidance of traumatic experiences altogether in the face of significant risk. What might that look like? What are some ways that we as communities or agencies support that for people?
Sorry, chatty Cathy over here, but just thinking about like building systems of community accountability that also like don't isolate folks who have done harm, but that do reparative work to like bring them in and break those cycles of doing harm and trauma. Yeah, like community skill building feels like a way to like actually prevent further traumatizing experiences.
Yeah, definitely. I think some people also think about addressing some of the root causes and access points here so that people feel safer and can resource up into accountability processes. Sometimes when people think about accountability, something that comes before that is safe and stable housing, which we don't always think about as a framework for or a necessary tool of accountability towards safety after significant risk, but I think it's something that we have to think about in this paradigm too. So those frameworks are ones I want us to lean into, especially because these resilience tools are based on an ecological approach. But very often we hear resiliency actually weaponized against people. There's a really stellar article in Teen Vogue which is titled "Resilience is the Goal of Governments and Employers Who Expect People to Endure Crisis." That many of the tools that move us towards resiliency logics ask people to hold more. And the focus on individual management versus social shifts can actually expand trauma, not reduce it, because it allows systems that do harm to keep doing harm and put the burden of self-care, of coping mechanisms, of recovery totally on the person who is habitually experiencing harm from those systems. And often when we tell people that they must be resilient, that individualized trauma becomes internalized. That assumption of fault and responsibility become our realities when we work exclusively on the low levels of the SEM. When we think about how can you manage your crisis individually or within your small network of closest people, how can folks around you absorb more of your trauma and crisis, and how can you just deal with it? Moves us away from actually restructuring our communities to build resiliency structures, and instead moves us towards allowing the systems that harm to perpetuate. So our big question today is, how do we move resilience practices up the SEM, up the social ecological model? I'm going to introduce a kind of revision of the social ecological model. So if that language is new to you and you've been like, not real sure where we're going on this, next slide is yours. And we're actually going to use the rest of our workshop space guided by this modification of the SEM from the Fireweed Collective to engage crisis within the SEM. So this is a modified version of the social ecological model, and it links or it has sort of 4 categories, and you can see it move out. At the center is the individual, and we sometimes talk about internalized experiences. This is also a space that is active, like people make individual choices, they manage their worlds in individual ways. The next level of the SEM in this model is the interpersonal, where we think about how folks engage with those they're closest to, or are in direct connected relationship to, or with people who have immediate power over them. The third level is the institutional level, where we often see systems that directly impact us, schools, social services, resources that serve as barriers or access points to some of the things that we need. And then finally, the outer circle is the ideological. These are the assumptions and norms that our society has that set us to believe certain things, and those beliefs actually make certain things possible and impossible for people all of the time. This specific one, I said, is from the Fireweed Collective, and is one that looks very, very specifically at the way folks who experience crisis, some of whom experience crisis habitually and are labeled with diagnoses for their crises, but anyone who experiences crises might navigate harm across the social ecological model. I want to pause here and see if anyone notices anything that stands out to them or surprises them, or just things should be said out in the world about this specific version of the social ecological model. Share what you're noticing. I am noticing we are quiet today. That's okay. This is the Fireweed Collective's a reframing of how we might imagine a reparative, restorative, and resilient model that engages all levels of individual, interpersonal, institutional, and ideological. Curious if there are things y'all are noticing on this slide, things that you see show up already in how we think about resilience or how we are practicing supports during COVID. Things that you notice on these lists that are not happening, that maybe need to. Somebody say a thing.
I feel like, oh, sorry, go ahead.
No, go ahead. You can go first, Hannah, and then I'll go.
I just was thinking that like the framing of this, that instead of there being these layers where there feels like a really clear power dynamic between like how institutions have power over the individual, instead on this level playing field, like they get to interact together, but there's not a hierarchy, which feels nice. Yeah.
What I was going to say is that I feel like most of the time when I hear about resiliency or when I think about resiliency myself, I think about it more on the lower levels, the internalized, maybe the interpersonal, certainly some institutional. But I feel like during COVID, it's really kind of pointed out that there, at least to me, that the ideological is maybe most impactful in a lot of ways, because it's from the ideological that we internalize all of those things on an individual level.
Yeah.
And so I feel like that's almost what's missing. I mean, you hear about the increases in suicide and depression and that kind of thing because of the isolation. And I wonder if part of that is rooted more in the ideological as opposed to the individual, if that makes any sense.
Yeah, I think definitely. Definitely. And I think part of what we're going to try to do is stretch today into thinking about how we activate spaces where we actually engage with the ideological. I'm going to have us, yeah, go ahead, Anna.
I was just going to say, I'm so glad that you said that. It makes me think like in a way that I hadn't really considered before about, especially in the context of COVID, where people are so disconnected from a lot of those like interpersonal and institutional, that a lot of times what we're left with is the ideological. And it's just like the doubling up effect of not only how much that impacts us, but not having access to those other spaces too. Yeah, that's
definitely.
Thanks for pulling that forward.
Yeah. I'm going to ask you guys to pull some other things forward. I'm going to pull us back to that shared document. And I'm going to ask you, as you feel comfortable, to do some group building in the first half of this. And our group building is going to have you sit exactly where you're sitting in your real life, in your real community. I imagine most of you are in county. And think about what it is that you are doing and what it is that you are considering or feel able to do to engage these levels of the social ecological model. I went ahead and did my own down below as some examples. I will drop my example model up into your model when this is over. And it's okay if things that are written down here contradict each other or overlap each other. What we're trying to get is a group idea of some of the commitments or the ways in which we, who are now a group of people together, might engage the county that we share, specifically around building resilient strategies for young people right now. So some of the things I think about engaging at these levels is that when I work with young people, I often share resources that let them have some self-coping resources. So things like the Fireweed Collective's Mapping Our Madness Crisis Workbook. There's a coronavirus anxiety workbook. These are some resources that you can hand to a person and they can work for themselves at the individual level. So engaging young people and having the resources they need also lands up on the interpersonal level, especially when we're connecting young people to resources that they need that involve another person on the other side of it. So we have the COVID Youth Resource Guide, which I will show you and link you all to, that we built out of our prevention team at Middleway House that links young people to a lot of resources. The Middleway House chat service. We heard from young people that now that they're stuck at home mostly, calling our helpline at Middleway House feels a lot less possible because their siblings and their families are going to overhear them and they're literally stuck at home. And so developing a chat service that they can access that's still confidential, we can't track their phone on it, and it still lets them have a safety button that they can get out really quick, but actually created a new format and forum for them to have interpersonal engagement that gets through some of the barriers for them when they're stuck at home. Supporting teen peer advocacy groups is another thing that I'm really working hard to activate in a new way during COVID, figuring out if we can have Zoom sessions and create connections for young people to learn from each other and know each other well enough that they can be safety nets to one another. And then I'm continuing to do building healthy relationship trainings, mostly for teenagers, to think about how they, when they're in this moment that their brain is developing their relationship tools, so before their prefrontal cortex really firms up and is a solid finished brain in their mid-20s, thinking very strongly about how we support them building healthy relationship patterns. At the institutional level, I'm working on building healthy organizational relationship trainings to actually support organizations and thinking about modeling the anti-violence empowerment models that we teach to young people, but don't expect young people to change the larger systems. We also do a lot, and I do a lot with cross-agency resourcing, so partnering closely with teen services at the library to make sure that we are creating institutions that are working to empower young people and that they have more than one landing space to do that work. At the ideological level, I engage in and part of norms reframing conversations with people at the state level with ICADV. And in terms of the anti-violence movement, where I work mostly, we have agencies that do sort of the county and city-based work that has shelters and housing and legal support. And then we have coalitions, which are at the state level all over the country, that do a lot of the ideological work around violence and a lot of the direct campaigning and a lot of the messaging that happens around violence and a lot of the direct engagement with laws and policies. So though I work at an agency, my commitment is also to work with the people who are setting norms about the issues that folks I work with are directly experiencing. And then also engaging at the national level, making sure that we know and move to the most ethical and the strongest articulations of care work that's being promoted by national coalitions. Thinking a lot about equity work right now, but making sure that the ideological frameworks that are accessible to us become part of our agency's inner working. And also, as we do that, feeding up to be one more agency and one more coalition that is part of a much larger story that is an ideological story. And so I gave you that example so you can see how I think my work in supporting teen write up the model. And I want you to do that same thing. I'm going to not share the screen so people don't feel like nervous typing a thing that everybody sees, but you have access to this document. It's still dropped in the chat. And I would love to see, while you're thinking through this, for you to start to drop some stuff in here about how you as a human in the same world that I'm in might start to engage working a little higher on the social ecological model as we support young people. So the two steps that we hear over and over again from young people as we work towards shifting a world that is easier for them to have safe practices within and for them to thrive within, especially in moments of crisis, is first just listening to identified barriers that teens themselves are identifying. I attended the session this morning, Teens Tell All, Navigating the COVID-19 Pandemic, and I got to ask directly of that crew, and I've gotten to ask of a lot of teenagers, like, what is it that you need to support your friends when they're not safe? What is it that you need to navigate crisis when your friends go through it? And their emphasis on supporting friends was that they were really struggling to find resources to do that they didn't know how to support their friends still, that they wanted to make sure that their friends knew and that they also experienced a world in which it was okay to experience crisis. They emphasized that schools should offer more resources and make them more widely known. And that's on us. Like, it is my responsibility to make sure that they know the resources that Middleway House and that I'm putting in their schools. It's on the schools also and teachers and counselors to make sure that young people are equipped in these ways that they specifically identify as barriers to supporting one another and managing crises in their worlds. The second point that we hear over and over again from teens are to work on changing the choices that they have available to them. And really equipping their agency. So thinking about really putting youth empowerment at the center, not just asking them what they need and then doing it, but figuring out how we equip young people to have choices that allow them to thrive up that social ecological model. Choices about the norms and the ideologies that circulate in their world are actually on many of us to create. And it seems really important that we don't just listen to the problem and come up with our own solution, but check our ageism and listen also to what young people think the solutions are, not just what they think the problems are. When we draw from some of the resources that emphasize protective factors in resilience, and these are just the summary points that are drawn out of two articles that are linked in the PowerPoint, which you all have access to. We see over and over again that protective factors sort of match. We see cognitive development, problem-solving skills, that's personal again, self-regulation, personal, relationships with caring adults actually comes up in all the studies as the #1 protective factor. If someone has the reliable presence of a sensitive, nurturing, responsive adult, that is the #1 protective factor. But a sense of safety, a community, goals for your future, specific things that young people are cultivating in themselves, coping skills and coping mechanisms that they have. We hear over and over again that these are the primary protective factors. And those protective factors move people's internalized dialogues really strongly. Sometimes though, those very protective factors leave people in this first statement. I went through trauma and had to figure things out. If I can, they can. Our protective factors lists often still guide people to feel like they have to do it on their own. Sometimes people feel like they have the equipment for that, and that feels empowering, that they can actually get through something because they have the tool set. But I think it's also really important that we sit with this other truth. This don't be happy for me that I overcame these barriers, be mad as hell that they exist in the first place. And when we talk about building resilience, we are actually talking about breaking down barriers, not just supporting people in overcoming barriers. I said the number one protective factor that is identified over and over again is relationships with caring adults. And I think the majority of us in this room might identify in that way as an adult who cares. Some of the strategies that we see asked for often by young people from their caring adults are non-judgmental active listening and affirming responses. That means listening without judgment, asking questions, not jumping to problem solving for young people, actually assessing youth barriers and listening to the barriers that they experience and not mistaking barriers for broken brains. I think young people feel writ off often. That their brain is immature is something that is real. Like they have not developed their entire prefrontal cortex yet. That also means it's dynamic and able to build healthy pathways and do really incredible work while it's growing and changing and pruning. And often kids and especially teenagers actually have a really good sense of their own barriers and a really good sense of their own needs. One of the things we want to commit to is having and sharing relevant and accessible resources to young people. And in this, an empowerment model sometimes means that you resource out. Young people, I find really often are very afraid that adults are going to take action on their behalf. And especially when they've experienced violence, there are laws that make that always true. Our mandatory reporting laws in Indiana say that if we know that a young person is experiencing violence, or if an elderly adult or a person with disabilities is experiencing violence, that we have to report. And adults are often very quick to do that. And young people often don't have their questions answered and often don't have any autonomy in the decisions that are made following that report. And so one of the things that we emphasize making sure young people know is that there are a couple spaces like confidential lines, like Middleway House's line, where they can call and actually ask their questions. And because it's a confidential line, and because there's no way for us to know who's calling, unless young people give us critical details about themselves, we can't start a report without their consent. And this is an important thing because it means that young people sometimes ask questions they would otherwise stay silent about. And it means that young people get to make the decisions and have some sense of agency, and often having questions answered may lead them to make the decision to make a report or to find ways to build safety for themselves in other ways, where sometimes the fear of reporting actually gets in the way of them getting the help that they need. One of the other things we do is work really hard on supporting teens and helping other teens. It's really critical that young people feel equipped because we know because young people are afraid of mandatory reporting and generally feel like adults are going to take action on their behalf without their consent, that it's way more likely that even though this is my job, that young people who are experiencing crisis are not going to come to me first. They're going to go to their friends, and they'll often go to their friends and say, okay, you can't tell anybody this. And that's too much of a burden for the young person who's holding someone else's story and experience, who isn't resourced themselves to support that other person. And it's too much of a burden for a young person to feel like they literally have no trusted adult or no resources outside of their immediate friend group who they have sworn to secrecy. I hear afterwards from so many teens who do decide to disclose violence or disclose a crisis to me that they've held that story for years, and only them and their best friend have been trying to figure out ways to build safety for them for years before they actually feel comfortable talking to an adult. And so one of the things that we need to do in these situations is make sure young people are resourced sooner to help each other and resource towards young people getting questions asked that they need. If you're interested in this, even if you don't want to volunteer for Middleway House, we have on-scene advocacy training and crisis line training that is free. And if you're interested in being able to do this sort of supportive work for teens or for other people in your community that experience crisis, you're really invited to come and skill up at being a caring adult through our trainings. These are some of the things from our crisis line training. And so I'm just going to give you a crisis line mini training rooted in a violence response. Some of the things that it's really helpful for young people to hear when they're experiencing crisis is, I believe you. The crisis is not your fault. You're not broken. Most folks who experience crisis blame themselves really hard. Resiliency models support people in blaming themselves really hard. Actually being a listener, letting them actually share their story, and make sure you're showing support, even if you don't like what's happened to them or don't like the choices that they have made about what has happened to them. And honoring how hard it is for a young person to talk to you if you are a caring adult in their life, even if you have a lot of trust between you. Making sure that if young people do talk to you, that you identify that you're still there to listen again. To make that invitation can mean a lot. I want to introduce you really briefly to thinking about how we might safety plan with young people during COVID. This is, again, directly in response to the earlier session where young people are like, we don't really have this equipment. And I want you to think about how you might safety plan next to a person. When our on-scene advocates safety plan next to teens at the high schools or middle schools, these are some of the questions I ask them to ask themselves. What questions can you ask that show deep care? How do you support the young person with resources while ensuring that the person feels like they're making all the choices themselves and not being told what to do? What resources can you actually offer? What considerations for support might you suggest if a young person's other experience and or lack of resources compound with an experience of crisis? And so not just focusing on the crisis, but thinking about the other conditions that impact a young person. This is our youth resource guide that we put together for COVID. I'm going to click on it and open it up for just a second to share it with you. This is freely available. It's on the Middleway House Prevention site. It's also linked into this PowerPoint if you keep it. And Bridget, who's on the call, also has a ton of hard copies and can spread them all over town. If you have a spot you want these to land, please be in touch about that. But our youth resource guide emphasizes some of the spaces where we're doing Zoom support groups for teens so that they can build out their own skill sets, some Zoom programming that we support, and then a number of hotlines and online resources that we're hearing from young people are really useful. I mentioned safety planning, and the My Plan app is my favorite phone app that supports you or you in supporting a friend as you develop a safety plan. So this is a resource guide that we've built specifically for young people to have more of the resources that they need while they're in COVID. And if you're in a space where you can help distribute that, we would really love for more young people to feel like they have this resource in hand. I want us to spend the rest of our time thinking a little higher on the social ecological model. I wanted to make sure you had some basic personal and interpersonal resources. We're not discounting protective factors, especially having trusted adults that are willing to do the work next to people as one of the core goals of actually thinking about building resiliency models. But I want us to engage a little higher. So SSNREs, safe and stable, nurturing relationships and environments. Sometimes that E gets forgotten, or we don't really manage our thinking all the way towards that E. And I want you to. I'm curious if there are specific ways that you feel responsible in your environments, that you can actively create safety nets. What power do we have and can we build in our communities and environments? Are you parts of agencies? Are you parts of groups? Are you a parent to a child who has 5 or 6 of your kids' friends who trust you which is not exactly an institutional, but it pivots into one as we think about groups and institutions that we might actually have impact to build in resiliency models to. Anyone have a space that you're like, I have a spot that I have influence? You can drop these also in that shared doc. Anyone have a spot where you feel like you have some influence in an environment or in a community space or in an organization?
I think this is a smallish one, but thinking about the space in which I work and the physical setup of our building, there are spaces that are essentially reserved that have doors that can close and can be like confidential spaces where folks can step away if they're in a situation that doesn't feel safe or where harm is happening, that like there is a physical place for people to like remove themselves from that harm until other people can be tagged in to like help create distance and boundaries and like appropriately assess what's going on and all of that. Yeah, so just like holding physical space for that, that also like has things in it that are nice, like comfortable chairs and like a space for someone to like de-escalate if they're in a hard situation.
Yeah. Other ideas? What environments are you part of? What institutions? What communities?
I just moved back to Bloomington after being away for 19 years, and I've decided to become a CASA advocate. So I'm just beginning back into this community and will be working with youth. I'm just going through training right now, and I happened to see this and I thought, oh, this might be a good place to get some resources.
Yeah.
So so I don't really have anything yet, but I'm working towards that, at
Yeah.
least on the interpersonal level.
Yeah. And I think that's also an organizational level. And I think it's really important for us to note these spots where we're like, I'm maybe not there yet. Like I maybe don't have a space yet, but like I'm entering an environment. I'm entering a crew of folks and a community in which I'm going to have impact because I'm making a commitment there.
Mm-hmm.
Yeah, thank you for sharing that.
Yep.
Anyone else want to share? If you're thinking about it, you're trying to figure out like where you might have power, there's a really fantastic resource that's linked here. That's from beautifulrising.org, and I like them a lot because they do a lot of youth organizing. And they've really got it together in terms of empowering young people towards engaging change at the like environmental and institutional level. And there's a lot of really fantastic resources on power mapping and a lot of really fantastic resources on thinking about making change in the environmental or institutional levels. And I like these guys because they're so youth focused and really focused on creating resources for the communities, who are doing resistance work. How about ideological work? How do you think you can actively debunk cultural myths about trauma and resilience with teens? How can we build microcosms, cultural ideological safety nets? We won't be able to change like maybe the biggest parts of media and influence, but can we build microcosms, cultural ideological safety nets? Young people are often trying to do that with their friends, create safety and create norms and create logics that they and their closest people share. Are there ways to think about this ideological work in ways that are supportive in our community? Can we curate equity-based norms or ideologies in youth environments around here? How do we shift policy and practice about the way youth are resourced in order to shift these norms too? Maybe you don't have answers to these yet, and that's okay. But if you have a specific question that you're going to commit to come back to and figure out an answer to, that document is going to stay live. And I'd love if people want to keep engaging that. I want this to be kind of a starting place, not an ending place. So I hope you keep these questions rattling around in your brains. And if people do have some answers about how they're doing ideological work, we'd love to hear them, because I think sometimes another person's experience can really inspire us to move out of like theory and hard questions and into a like, oh, I could do that. Oh, I could do that. Most people start when they think about ideology with policy, and I didn't start us there because I want us to think beyond just changing a state that's built against some people. And I think it's really important that we don't assume that we're going to change all the laws. But I think it is a really big part of ideology shifts, especially those specific laws that move us to believe in certain language and believe in certain investments, like our young people and their resilience. I linked in 2 resources on this slide. The OECD has set policy for youth in COVID-19 and specifically has set up an action plan for how we might engage policy at the national level to think about our response, recovery, and resilience building at federal levels, and also as we engage policy at lower levels of government and with those people who make decisions in our communities. And then there's been 2 acts that have been introduced that's worth mentioning. The Children's Protection Act and the Strong Support of Children Act. And I just pulled this quote, which is from a longer resource about these acts, which are also linked in the notes to this. But the system must prioritize preventing traumatic harm so that every child grows up feeling safe and supported. Together, these historic bills represent a holistic approach to addressing childhood trauma that meets the growing needs in our communities. They depart from a status quo that entrenches cycles of trauma by responding with punishment, criminalization, and surveillance, and instead center trauma-responsive policies that emphasize healing. So if these policies go into play and our focus on how we deal with harm suddenly engages and invites everyone to engage words like holistic, healing, trauma responsive, how does that shift for us? How does that shift what seems possible? How does that shift what seems normal?
Well, right now it seems that we are addressing the aftermath rather than focusing on preventing.
Yeah.
And parents would need to be given tools and skills prior to maybe having a family, and address any family issues that they may have had, any of their issues that they grew up with or under. So it required more education, and whether or not our current system would accept that is the biggest question, because it feels like that would tread on their freedom.
Yeah.
And their knowledge of being a parent. And I know how to be a parent.
Yeah. And I think part of that work moves us up the social ecological model. Like, what if healing and holistic repair and trauma responsive policies and practices were in place in our institutions in a way that became the normal choice for things like parenting? And I think very often we educate I educate teenagers all the time, it's my job. But it's only when teenagers take and move themselves into communities that do the work of accountability, of care work, of supporting each other, and create microcosms and systems that moves from being the hardest choice to shift everything in a violent culture to an easy choice because all their friends are doing it. And I think it's so important as we think about resourcing parents, we think about resourcing parents in a community of parents in which the easiest choice is healing, where the easiest choice is to have resources that support trauma responsive policies, where the easiest choice moves away from punishment and towards repair work. And absent those things, it's going to be true that we do keep perpetuating these systems. And until it's actually the norm, I think parents will stay with like, oh, I know how to do this, until we actually have some of these norm shifts, for sure. I'm going to leave you with these two questions today. I want you to think about your active practice going forward. I said this is just like a little touchstone on a pathway to what I hope is your rest of your life, that you think about how we build resilient systems. And so one of the things that I want you to ask yourself, these are questions I sit with every day. How could my practices more closely match my commitments today? Like I literally have these questions for myself and I engage them every day. But how can my practices more closely match my commitments today? Maybe you drafted some things in that document. Maybe you are thinking about drafting some things in those documents. Maybe you just like had some ideas and they're not ever going to land there, but they're yours. I want you to think about how your practices might actually line up with your commitments. How can you move the things you want to do closer to the things you believe? Or even bring them totally together. And then the second question, was there anything that I did yesterday that worked against the commitments I've made? If so, how do I clean that up? I think it's important that we keep recognizing that we are not going to enter a world where we build resiliency with any perfection. It is not the easiest choice. And so asking ourselves again and again how we do the work of rerouting and repairing, moving ourselves towards the practices that press us into actually enacting our values of supporting young people and being accountable to ourselves and other people when we choose different pathways that might move back to blame shame models when people don't get their own resiliency work right and don't do trauma right. I want us to keep checking those. I want us to keep working on checking the systems that tell us that the burden should be on the individual in terms of resilience. Yes, we can skill up at the interpersonal level and the individual level. And I want us to keep checking the spaces where we assume that that's who should be doing resiliency work, those who have been harmed. I would love if y'all have any questions or reflections. We've got just a couple minutes and you can drop them here like out loud or in the chat. And if you have questions for that question garden, I'd love for you to drop questions there and maybe also think about some other people's questions and if you have good answers to them. In that document, the PowerPoint's linked and all the resources that I spoke of throughout this are all linked there too, so you can go back to them. Hope this has been useful.
Thank you so much, Linz. Thanks to you and for all your insights and information, and thanks to everyone who showed up and have been contributing on that document. It's really great to watch. The last thing we have for today is the closing session, and you'll find that Zoom link in the MC Summit program that was included in your registration email. And keep in mind that that link is the same one that you used for the opening session and lunch. So yeah, make your way over there in 1 minute. Thanks so much.
Thank you all. Thanks, Bridget.
Thanks, Liz. That was great.
I'll see you later.
See ya.